Good morning, everyone. I am Archana Siodas, and today I am teamed up with a very fine young gentleman, Mr. Akmal here. We would like to welcome everyone present here today to our webinar entitled Setting Up a Dental Practice. You will have the opportunity to submit your questions to today's presenters by typing into the chat box. You may send in your questions at any time during the talk and we will address them one by one.
Hello everyone, bonjour. Thank you everyone. Thank you again, Anchana. I would like to thank you all for coming to this morning's Alumni Rendezvous program. We all gathered here, Rendezvous fitting the title, which means gathering in French, for the last PVC program of the year before bring down the curtains. So sit back, relax and enjoy this session of sharing experience, opinions and doubts on today's topic, establishing a dental practice. Très bien, merci beaucoup à tous. That one is French. So I would now like to introduce our panelists here. Today we are privileged to have like three beautiful young dental entrepreneurs here as our panelists. They will spare the next 1 hour helping us clearing doubts regarding the establishment of a dental practice. The first panelist for today is Dr. Gan Chi-Hui, or Dr. Stephanie as we call her. She's from batch. Yes, hello, Dr. Stephanie. She's from batch 5. She didn't do any postgraduate studies, and the only qualification is BDS in PIDC. But fret not, Dr. Stephanie is filled with experience. She worked in KKM in Terengganu from 2013 until 2015. From 2015 to 2016, she's working in the Living Well Dentistry Melaka. 16 to 17, she works in a White Smile Orthodontic Dental Braces Clinic, Kuala Lumpur. And 17 to present, she's finally become the owner of Stephanie Gan Dental Clinic in Tawau. So as a fellow Melakans, she's not really serving here, but the experience brought her to Sabah instead. She's the co-owner also of Blossom Dental Clinic, Berjaya Dental Clinic, Aloha Dental Clinic, Harapan Dental Clinic, Noble Dental Clinic, and Apollo Dental Clinic. All these clinics that we heard is from Sabah only.
And our next panelist is the very beautiful Dr. Ratna Devi Sundaram. She is an alumni also from batch 5. Her qualifications include BDS from PIDC, PG in Diploma of Ortho, AFO New York, DSD residency by Christian Coachman, ICOI fellowship, which is in progress. Dr. Ratna has an immense work experience starting from 2013 to 2015 in KKM Pahang, continued until 2017 in Dr. Lee and Partners Dental Surgeons, and now Dr. is in T-Low Dental Clinic, which is also the proud owner of, residing in PJ Selangor. Dr. Ratna is also the co-owner of various iSehat Dental Clinic in Pasir Kudang, Johor Bahru, Bandar Dato' On, Johor Bahru, Bukit Indah, Johor Bahru, and also a new and upcoming one in Setapak, Kuala Lumpur. Welcome, Dr. Ratna. Akmal, we can't hear you.
Now can?
Ah.
Okay, sorry for the technical problems here. And finally, we have Dr. Chan Hoyan, also from batch 5. She's from our session earlier. She seems quite close with Dr. Stephanie, so I bet they are best friends, you know. And quite energetic and really vibrant person. The qualification, she completed her BDS and FICCD, FICCDE. Her work experience includes working in KKM in Greece, Milan from 13 to 16. From 16 to 19, she works in O and Co dental surgery. And from 19 to the present day, she's the sole proprietor of the Caring Dental Surgery. She's also the owner of Chan and Co Dental and Glow Dental Clinic. Welcome.
Co-owner.
Co-owner, yes.
Let's not leave my part out. Konnichiwa. Conjunction of Tokyo Olympic. Konnichiwa.
Konnichiwa.
Yeah.
Okay, again, I would like to remind you all that you may address your questions throughout this talk, my fellow audience. No holds barred, but please nothing informal or overtly sensitive. I also would like to address your questions. If you would like to address your questions specifically to any of these fine young ladies here, please mention their names so that we can relay the question to the correct person of interest. You can also ask the questions at the end of the session. Thank you.
All right, without further ado, let's go into the session today. So, Dr. Chan.
Yeah.
At some point in time, each one of us feels like being our own boss. Don't you think so? The reason may be multifold, like long working hours, less pay, or an unconducive work environment. So, doctor, when is the right time to set up a dental practice?
Well, if you ask me, there is no right time. Whenever you feel like you're ready, actually you won't feel ready. When you feel like you want to set up a dental practice, that's when you set up a dental practice. But not everyone wants to set up a dental practice. If you can find a dental clinic where you can become an associate and you work comfortably there, and you think it's a conducive environment to work in, you can actually stay on. You don't really need to start your own practice. But in my opinion, if you are the ambitious type, you want to open your own clinic, then it's better if you work with someone else first for at least a good 3 to 4 years or maybe 5 years before you come out to open your own, because you need to learn how to manage your clinic as well. I wouldn't suggest that, straight after you graduate, after you serve the government for say 1 to 2 years and then you open your own. I think that's a bit rash, in my opinion.
Yeah. Any other doctors want to jump in? Any other inputs?
I would say you have to first ask yourself if you're ready. When we ask, talking about being ready, it's not just being ready in terms of, what is it called? Your skills and all that. But you have to remember that when you jump into private practice, it's not just the skills. You're wearing many, many hats. It's not just one hat. You become an business owner, which means you have to manage your staff, you have to manage your finances. So you have to ask yourself whether you're ready financially, you're ready with your skills, whether you're ready to work longer hours. Because previously you said, long hours when you're working with others. Trust me, when it's your own business, you probably end up working much longer hours in the initial stages. I would say probably all of us, in the first few years of our own practice, we would have worked even 7 days a week. And that's for a while before you can become comfortable. So yeah, you have to consider all this, whether you're willing to make all those sacrifices before you can start it off.
Okay. In my opinion, if they ask me, like many of the dentists ask me when is the right time, in my opinion, I think now is the right time. So of course you have to, like Dr. Radha said, you have to be financially ready. You have to be mentally prepared, because opening a dental practice is like not doing patients only. You have to spend a lot of time, okay, to learn about management. For me, management is the most tedious part comparing to doing a clinical work. Management in terms of your financial management, your staff management, as well how your clinic work. You have to work in a team instead, not you yourself. So for now, because now we have a lot like multiple MCO, never ending MCO. So for now, it's not to say that, oh, it's MCO, I'm gonna wait until it ends. Actually, if you are financially ready, you are ready to take up challenges during the MCO, and you think that you are confident to manage your staff, for example, your dental nurses and your receptionists, I'm sure now is the right time, because from my experience, number one is now the bank, they have offer a lot of professional loans with a lower loan rate. And number two, I'm sure there are a lot of shops offer lower rental rate as well. So if you are mentally ready and financially ready, I can suggest you can find or do research on the shop lots that you want to have a look at. And of course, you can go different banks to ask about the loan, so that you can actually set up your clinic in a very more organized way and a proper way instead. So for me, not everyone is perfectly ready. So if you're ready financially and mentally, as long as you work and you open your setup and the clinic, you will learn as you work. This is my opinion now.
So basically, the crisis opens up the opportunity
Exactly.
in these hard times, So as we have discussed before, setting up a dental practice requires one to not actually just predict the timing, like now, but also to increase their demand, their income, delivering proper oral health care promotion in the particular area, and also to ensure one's future in this field. Of course, in this process, there will be numerous challenges faced by the practitioners. From your experience, Dr. Ratna, what are the challenges that one might face upon establishing and after setting up a dental clinic? The challenges
During or after or during?
during and after.
Well, if it comes to during the setup, I would say one of the biggest headache is usually to get the licensing done. Because when it comes to submission of licensing, you do have a list that you have to submit, but this license for licensing, you will have to submit to CCAPs, and with CCAPs, although they have a list, there's always something additional that's going to pop up every single time. It depends on the offices that you're dealing with. So that's one of the first few things that you have to look into. But that again, you learn through experience, but it would always be very, very helpful to speak to someone who's already done it before. So here's where it's good to have a mentor before you start. If you're planning to start a business, or a clinic, it's good for you to have someone that you do refer to. This person would guide you through, and it will save you half the headache. This is before starting. And after starting the first 6 months, you have to be mentally ready that the business is going to be slightly slow, but this is where you start strategizing. During the first 6 months period, you start strategizing, and based on your location as well, you would have you would have thought about your target market. How are you going to start letting people know about your presence? It could be through marketing, but again, when it comes to marketing, it's a very controversial topic in dentistry or even medical, because you can't do direct marketing. In that case, again, you might have to have your social media presence, website, and everything. The next few things that you will have issues with is your overheads in the first few months. So this is again something that you have to be prepared for. So when it comes to starting up dental practice, initially you would be prepared with the initial amount that you would need. That's your initial budget. But when you actually come up with your budget, you have to remember that you have to also add in the budget for the first 6 months. Your overheads, that has to be part of your budget as well. Because for everything else, even equipments and all, you can do leasing, but not when it comes to your next 6 months overheads and all that. That is something that you have to come up from your own pocket.
Okay, doctor. Just now you said CCAPs, right? Would you like to elaborate more on what CCAPs means?
Okay, CCAP stands for Cawangan Kawalan Amalan Perubatan. What's S? Swasta. Sorry.
Swasta.
Yeah, swasta. So they're the tax board for any dental or medical practice.
Yeah.
For a dental clinic, you don't necessarily have to have any other licensing besides the CCAP's licensing, which we call it the Borang C. In order to get that, you have to initially submit a few documents. Initially, you have to do an online submission of documents. And then you have to submit your floor plans. The floor plans itself has multiple criteria. And then once they approve your floor plan, only then you can start off with your renovation and everything else. Once you're done with the renovation, you then move on to informing them that you're done with the renovation. That's when they will come in for an inspection. When they come in for an inspection, you have to be ready for all their critiques or whatever it is, whatever changes they have to make. Once you make all the changes, they might come in for another inspection. And a month later or so, that's when you get your license. So this whole thing is handled through CCAPs.
And there's another question, doctor. Dear doctor, how much minimum is considered financially ready? How much is needed and how much can be low?
It really depends on, there's a few things again here. When it comes to budget, right? It depends on which area you're going into. So rental is one big factor. So based on your rental factor, that is a separate budget. So assuming that you're going for a first floor in KL, on an average, you're going to be paying anything between 3,000 to 5,000. That is per month. So that's a separate one. And then setting up a clinic itself, cost of equipments and all that, even that you can actually cover with leasing if that's what you want to go for. That again brings you back to renovation. Renovation, it depends on how, to what extent you want to go for your renovation. So I would say on an average, about 100 to 200,000 on renovation is a decent amount. So all in, without Xray, maybe about 300,000, 300 to 350,000.
Okay. Any other doctors would like to share in their experience?
Depending on your setup, it all depends on your setup, how simple you want your setup to be or how extravagant you want your setup to be. Yeah, so if you want your setup to boom, I want 10 chairs in the center, then of course you need a lot more money lah. But if you want a basic simple setup, always set up with, if you're alone, say you're alone, if you have no partners, you're going to work alone in the clinic, then start off with just one chair first. In my opinion, I would prefer to start with basic first. Of course, when you design, when you plan your clinic, you can always plan future surgery rooms. You can have 2 more surgery rooms without chair. You prepare first, but you install only one chair first because you need to take into account your overhead expenses, like what Dr. Ratna mentioned earlier. So you need to reduce your overhead expenses first for the first 6 months, and say 6 months later, wow, your business flourish. Then that's when you add another chair. The chair is always there. It's not going to run away. Yeah.
All right, thank you, Dr. Chan. Next question that we have is from batch 18. Is it possible for us to send our floor plan to CCAP's officer before we submit all the documents, Dr. Stephanie? Do you have say on this?
Okay, like Dr. Ratna said about the CCAPs, in fact, every state has their UCAPs. UCAPs is like a branch for every state in the different, like Malacca, Sabah, okay? Each state has their own UCAP. So initially, when you want to submit your documents, you have to go through UCAPs first. So that means you have to take out the list, prepare the documents that they need, and then you send to UCAP. So after UCAPs has approved your renovation, okay? So after the renovation wise, they will send you a surat tiada halangan. You have 3 months for you to do the renovation. So just now, when UCAPs has already sent for the approval, means came for inspection, they will send your report to CCAPs. So CCAPs every 3rd week of the month, they will have a meeting to see whether your application is approved or not. Once they approve, you pay for the registration fee, then you can open your clinic officially to get the Borang C.
CCAPs is in Putrajaya, yeah?
Yes, yes. CCAPs is in Putrajaya.
To each state.
Hello?
Yeah. So we have to go to Putrajaya by ourselves and resolve this CCAPs thing, is it? And next question is to Dr. Chan here. I can feel her eagerness, you know. She wants to answer questions, you know.
No, that's not true. Please don't put words in my mouth.
Sorry, my line was like just now. What was the question again, Ahmad? My line was like just now. Sorry, can you repeat again?
No, we already like finished your question, your turn.
Oh,
Doctor.
okay, sure. All right.
So now is Dr. Chan's question. I give you this question for you. How much is the average professional loan rate, doctor?
Of the sorry again.
How much is the average of professional loan rate that we can apply?
Professional loan rate. You mean your leasing rate? Is it?
Um,
Oh, I can help
um,
Hoya. Actually, I can help Dr. Chan if you want
yeah,
me to.
please.
Is it okay?
Leasing rate
Well,
is not.
I think
Uh,
about professional loan is the loan that given by the bank.
Uh-huh.
Go ahead.
Hello,
Go ahead.
sorry,
Go
the
ahead,
line.
go ahead, Dr.
Oh,
Stephanie.
don't mind, Dr. Chan,
No,
can I
go ahead.
answer? Okay,
Because
okay.
this-
There are
go
two
ahead.
types of okay. There are two types of loan actually you can apply for the clinic. Like Hoyan said, it's a leasing. Leasing company is they will handle with a supplier so that your dental chairs and your equipment you can actually pay by installments every month. Professional rate is a different thing. Professional rate you have to apply personally to the main bank, any banks that in locally. So usually, like for example, I just give an example, okay? Like Maybank, they provide professional loan of 200K, okay? So it depends on what is your setup. Is it a sole proprietor or Sdn Bhd? They will actually how to say, they will do audit on your clinic and see whether your documents is eligible for the application. So the loan rates, it depends on different banks. The professional loan is different. Depends on different banks. You have to sort out with the agent in the different banks to compare, because they will have two criteria. Number one is they will see your sales for every month. Number two is they will see how long your dental clinic has been set up. So based on these two criteria, they will give you the proposed rate by the bank and how much loan you can get from the professional loan. The leasing company is a different thing altogether. Leasing company, you have to find like Oryx, Kim Leasing. That one they will deal with the supplier for the dental equipment. Professional loan, they bank in the cash into your company account. So it's two different separate entity. So if you want to have the professional loan rates, you have to ask on independent banks.
I think
Sorry,
what?
Hoyan.
No, it's okay. Why are you sorry? Professional loan, I think you can apply only after you have your clinic, no? You run your clinic for a while. So I think in regards to our topic today, setting up a dental practice, then leasing rate would be probably the more suitable question here. Instead of professional loan, because you need to have a clinic already for your professional loan, right?
In fact, actually, I have a professional loan being how to say processed lah, even though the clinic was not set up. So you can actually try to apply first. It depends on your agent of the bank also.
I see.
I-
Okay.
Maybe it depends on the credit score from
Yes.
the applicants.
Yes.
All right.
Yep.
We have a question. The question keep coming in. I'm really sorry. All right. Next is for Dr. Ratna here. From Muhammad Hilmi bin Osman. Hi, Hilmi here. How long it usually take for a CCAP's approval?
There is two phases of it. The first phase is the approval of your floor plan. That usually they say 7 working days, but you're again looking at a good. And so it's a no objection letter that you get for your floor plan. That's the first phase, right? So that they usually say 7 working days, but it usually doesn't happen in 7 working days. We are looking at a good 3 to 4 weeks. So you wait at least for one meeting. That is if you are lucky to enter that meeting. If you had just missed that, then you're looking at another additional 3 to 4 weeks. So that is the phase 1. After that, once your renovation is completed, when they come for inspection, after that, they give you a letter of approval. For you to get your letter of approval, it takes about roughly again a month. And finally, for the official Borang C to come in, maybe another month plus.
Okay, doctor. Another question from Zian. This is to Dr. Chan. Hi, Dr. Chan. Thank you for your advice in regard of working for someone first before considering opening on our own. Having said that, will we, a newly graduated dentist, be able to apply to work under you for the experience or any other panelists? If so, how do we apply? Thank you.
This must be Dr. Leong Yisian, right? Of course he can. Of course he can, but he is currently working under a very prestigious specialist, perio specialist, so I don't think he needs to apply under me or panelists here. But yes, you guys are welcome to apply. Why not? Yeah. So no, but jokes aside, you should always look for a place where you can learn. You need to learn more things first. You need to sharpen your skills first. To be very honest, it's all about experience. The more you work, the more sharpen your skills are, then the more ready, the more confident you are to actually open up your practice. This is straightforward and simple as that. So I in the beginning, when after you graduate, when you're working with someone, you will feel like, oh, you're being undercut, like, oh, long working hours, you know, I work so hard, so many patients for me. Don't complain that. The more patients you have, the better it is. Practice, practice, practice. And I used to work from 9 a.m. to 10 p.m. Yeah. So but that's not the worst of me. My other colleague, my friend, actually work even longer hours, 5 days a week, 9 a.m. to 10 p.m. So, but that's how you develop your skills lah. So then after that only you will get this confidence to actually come out to open your own.
Okay. So thank you, Dr. Chan. There's a question in the chat box here. I'll just gonna try to finish this one here first. And a reminder, housekeeping message for the audience. If you have any questions, please type in the Q&A chat box. Thank you. The next question is for Dr. Ratna. What is the difference between sole proprietor and a sendirian berhad?
Okay, a sole proprietor is when you plan to be the only owner, so the single owner, that is a sole proprietor. In that case, you don't have to start up any specific company under SSM or anything. So the entire clinic, the license goes under your personal name. You're the only owner. So when it comes to sendirian berhad or private limited, that is basically limited. You work with a group, with a few partners. It could be 1 or 2 partners. In this case, currently, your partners, the directors can only be dentists. Am I right?
Actually, I'm not too sure about that.
Yeah. So they do say that you can have a non-dentist partner, but when you submit it to the CCAPs again, they might reject and they ask you to remove the non-dentist from the directorship. But
Stephanie might know more about this.
I experienced this before because okay, what happened to me was, okay, I submitted for the SSM for okay, there are 2 different roles in sendirian berhad. Number 1 is called directors, another one is called shareholders. Okay, so for example, in my case, I have a non-dentist partner in my sendirian berhad, so I put both our names there as a director and shareholder. But when we submit to CCAP rejected my application because she said for directors, all directors must be a dentist, a professional dentist with APC. There shouldn't be any non-dentist in the director. So what I did was I applied back to SSM. I removed the non-dentist director in the director list. So now the director is only me, but the shareholder is still me and my partner.
That's right. Yeah. So you can have a non-dentist shareholder, but not as a director.
Yes, correct.
Thank you. All right. Next question for Dr. Stephanie. From Dr. Jeffrey. Hi, doctors. I have some doubt here. Do we need to set up our company first before submit to UCAPs? For example, a sendirian berhad. Second question is
one by one.
Okay.
Okay, one by one. Okay, a lot. Okay, never mind. I answer the first one. Sorry. Okay, number 1 is okay. Yes, initially my first clinic, I want to actually set up a sendirian berhad, but I overlooked the criteria. So when I do the submission, they need the SSM number because every company that is set up in the SSM the board, they have a SSM number. So I didn't have the SSM number because my application for sendirian berhad was not completed. So if you are going for sendirian berhad, you need to register your company in the SSM first. Once you got the entirety and the certificate with the numbers, then only you submit to CCAPs. Okay, but if you're planning to go for sole proprietorship, then you don't need to register. You can straight away apply for the the online CCAPs, MedPAC, they call it. Second question, sorry, can you really follow up?
Right.
Sorry, I read
For dentists, you probably don't know where do we register this Sdn Bhd. You have to go through a secretary. So you have to get in touch with the secretary and then submit all your details, your details, the directors and shareholders' details. And again, it takes about 7 to 10 working days for you to get the Sdn Bhd ready. Only after you get that, you can submit to UCAPs or CCAPs.
That's right.
Yeah, that's right.
You need a company secretary for it now, for your registration of a Sdn Bhd. You need to look for a company secretary.
Okay. Second question.
The second question is a sole or partnership, which is better for starter dentist and in a long run. Okay. Dr.
Chan.
Dr. Chan, please.
Well, it depends. Really, a lot of things really depend. Don't you think so?
I like the answer.
If you think you need someone to work with you, if you can find a partner who you think is a good match for you, then yes, by all means go ahead. But there are a lot of things when it comes to partnership. You need to really understand how that person works and whether or not in the long run you will have argument with that person or not. And things like this. There's a lot of factors involved. Try not to look for your best friend or your friend, or you might lose a friend. But my partners are my friends lah. So, but so far, touch wood, they are all okay. So it really depends. For a start, you can always start off your own first lah. You can try to build your clinic yourself first. Later on, when there are partners who wants to join, your business very good, can I join? Of course, you may join. Open second branch with a partner. Then that's when you need to come up with an agreement that your first clinic is your own. Then the second clinic with the partner. Then that's when you share a revenue with. You can always register the second branch clinic under Sdn Bhd. It doesn't mean that your first is a sole proprietor, your second one has to be a sole proprietor as well, even with the same name. It can be of Sdn Bhd shape. So if that answers your question, for starter, you can always start off with sole proprietor if you don't have anyone in mind for partnership.
Okay.
And next, the third question from Dr. Jeffrey here, the location-based, city or outskirts, based on your experience, which one is a more preferable locations to establish a dental practice? Dr. Ratna.
When it comes to location, really depends. That's one of the main planning that you have to do. Location is, I would say, 50 to 70% of how it's going to go. If you ask me, I would usually go for a central location. It has to be central, it has to be visible. And then it also depends on your target clients. Depends what kind of treatments you're doing. If you're going for like a general practice, then anywhere should be okay. But if you're going for a targeted market, like if you're doing implants and orthodontics and all that, you might want to choose like somewhere closer to where housing areas, or like where the universities are, something like that. Depends on your target market. It always depends on that. And another thing that's important about location is, of course, your budget lah. Depending. So if you're looking for somewhere more central, it's going to be more expensive, but and somewhere more remote is going to be slightly cheaper. But if it's your first practice, you might want to go somewhere in between, not too high end and not too remote as well.
Okay. If you're starting your own clinic, you probably want to start a location that is nearer to yourself to wherever you're staying. You wouldn't want to open somewhere far and then you need to travel every day to work, right? Yeah, that's unless if you think the outskirt has good opportunities, good potential, then yes, you can open up there and hire someone to work there. That would be your future branches lah.
I would again like to remind all the viewers you can feel free to drop your questions in the Q&A box. You may send in your questions at any time during the session, and these beautiful ladies will try to answer as much as they can. Okay, our next question to Dr. Gan. Good morning, doctors. What is or are the most costly part for maintaining a clinic? Rental or clinic staff salary?
Good question. Okay, actually the most costly part is the dental materials. The dental materials part, overhead, okay, every month overhead is like you have to pay your rental, you have to pay your utility bills and your rent, your staffs. So staff actually, their salary is considered variable compared, how to say, depends on the different states. Some of them is 1,001, some of them is 1,002, the basic salary. So for my opinion, the most costly part is the maintenance of your dental equipment and your dental material costs. Because from my experience, why do I say so? Because some of the new dental nurse, when they, for example, they doing a composite filling, okay, they sometimes the material, they will just dispose a lot on the dental chair, because once the material has been placed on the dental chair, you cannot keep back, you have to throw it away, right? Because it's infection control. So for my case is some of the dental nurse, they are not aware how costly is the materials. They will just put a lot of materials on the dental chair, the composite, the molding agent, as well as the disposable items like the bibs or the tissues, everything. So for me, the most costly part is the disposable item and the dental material. So in order to control that, you must have a stock list or a checklist. You have to check your stocks every week, so that to make sure your dentist or your permanent officers and your nurses doesn't use the materials in a more wasteful method.
Okay, doctor.
Right, thank you, Doctor.
Thank you.
All right, moving on to our next question, Dr. Chan. How much startup model budget do you recommend? How much do we need to fork out from the model for this?
Sorry,
Do we need to fork out from our own pocket, or we can
I
just
get what
start
you
up?
mean. You mean
Yes.
okay, when you're setting up a clinic,
And I mean,
to
like,
me,
can we rely fully on a bank loan? Yes.
no, definitely not, because renovation is full in cash. You need to pay in cash, yeah. So I would say basic cash. You need to have about 250,000 at least, because you need to pay your renovation. Your renovation says about 150,000, and then you have to pay for your dental materials. The dental equipments, although yes, you can apply for leasing. In the beginning, you need to pay an upfront of 10% deposit, which will be refunded back to you after the leasing is fully released to the supplier. So, but you still have to fork out that money first. You see that 10% deposit first to the supplier. So that's a chunk of money. And then your rental deposits of 3 months, 2+1, those are cash as well, yeah. And also, like I said, dental materials, those you need to pay the supplier straight. They usually give you probably a 1 month credit term, but yeah, those are your cash as well. A lot of other things, like you need these at least this 250,000 in hand to pay for miscellaneous that you might not see, that might be hidden. Your signboard your whatever other majlis licensing, all those need money as well. So 250,000, I said, would be a good amount basic. Yeah.
That one is for deposit. You're talking about deposit.
Deposit.
Doctors, sorry, Akmal.
Sorry,
Oh.
Akmal.
Continue.
Okay. Another question to Dr. Ratna. Hi, doctor. Wanted to ask, what do you think of digital dentistry? Is it worth to invest in those modern equipment, or now is not the best time to invest yet?
Digital dentistry would cover a few things. Even X-rays are now digital. Then the others are probably intraoral scanners and stuff. So intraoral scanner is probably not one of the first things you want to buy. We can still go with the traditional method of taking impression and all that. But the others, when it comes to digital dentistry, definitely they will add on value to what you provide and to how you work as well. It does make things easier.
Okay, doctor.
but depends again on your budget and maybe not in the initial stages.
Okay, Doctor. Dr. Stephanie, would you like to add?
I agree with Rana actually. No comments on that.
All right.
Okay.
All right.
Next question is for Dr. Stephanie. Is it possible for us to order dental instruments, dental chair, or dental materials by ourselves, not from the local suppliers? Will CCAPs check all of these? Except the Xray, autoclave, and also the compressor.
In my opinion, because all medical devices and instruments have to be registered by there's a association for the dental suppliers. So I would not recommend you buy yourself, because number one, if there's any problem with the equipment or the dental materials, you have to be responsible for it. So as long you buy from the suppliers will actually follow up with your equipments, your dental chairs, and your materials. So for me, I would rather I would rather buy from a trustworthy supplier than buying myself. I know buying from online is very cheap, but number one, you don't know whether there's any parts being changed in between. Number two is you don't know whether the authenticity of the products. And number three is actually consider not recommended to buy online because you don't know where is the source. So it's better for you to buy someone that you trust. A trustworthy supplier instead of buying online. The most important thing is the follow-up. If there's anything happen to your instruments or your dental equipment, the supplier will send technicians to help you on especially autoclave and dental chairs.
Any comment, Dr. Chan, about this?
I think it's what she says is right. There's also a medical act, a medical devices act that regarding that you can't actually bring in things yourself because there's an act on it. So these suppliers actually have to go through a lot of submission of documentation to actually to get this license to actually sell these devices. So you better check on that if you really want to go ahead and buy your own thing. You have to check on that, or else you might get some fines or penalty. I'm not so sure on that. Just get from your local supplier. Most important thing, like what Dr. Stephanie said, is after sales service, make sure they are able to provide you with after sales service quick enough.
Yes, quick enough.
Okay, we have the next.
Sorry, I just want to add something. The fines are quite heavy. If you're caught using an equipment that does not have that is not registered under the Medical Devices Act. So it can range from what I know from 10,000 up till 200,000.
May I ask this thing that we have to see is it like the certificate from CRIM or ISO that we have to be aware of?
It's something like that. So they have to submit all the ISO certification, and then they also get a certificate on that. They do pay quite a bit for that, which is why not all equipments are registered. And it's quite a tedious process. So let the suppliers do it for us, and that might be quite easy.
Okay, Doctor. Next question from Eugene Cook. Hi, ladies. Very happy and proud to hear that all of you are doing so well. Long question ahead for all three of you. What are some of the trends in private practice in Malaysia? For example, the competition you expect to see when students come out to private in about 5 years' time. And what advice do you guys have for us to stay ahead of the curve? Thank you. Dr. Ratna?
Question again. Definitely.
Eugene.
Anyone would like to?
Thank you, Dr. Eugene, for asking us such a long question.
Exactly. I have to digest that question. What does it mean?
Actually, could you just repeat that? I need to digest that again.
Yeah,
Some of the trends in private practice in Malaysia, like what are the competition you are facing now, being in private practice, and that's the first one. And you expect to see when the students come out in about 5 years' time. I think what he's trying to say is what competition you will see when more private practice are turning up in Malaysia. The competitions you will get when more private practice, when there are more private practice startup in Malaysia. And what is the advice you have to stay above the competition so that you don't run out of business?
I think one of the biggest challenges would be saturation. If I would just take around my area, for instance, previously there was only one dental clinic there. In the past 2 years, there's been an additional 5 dental clinic in that same area. So saturation is one thing, but to stay ahead of this, you have to keep sharpening your knowledge. It means continuous dental education is really, really important. You can be a super GP by just doing. You can probably say that you have mastered your fillings, your veneers, and all that, but it's still important to do other treatments as well. Orthodontics is probably one of the most important things to do now. Almost every other dental clinic, even though it's a GP practice, you need to get to starting with braces as well. That's one of the things. But so getting ahead with your I would say knowledge is one of the most important things. And then what else? Hoyan, would you like to add now? My brain has
You probably can try to acquire a new skill. I mean, really, because you want to stand out of the crowd, right? So many people can do ortho, many people can do implants, many people can do a lot of other things. So you need to find a trait that only you can do, or probably a few of you can do. So I was actually quite intrigued by the idea of studying to be a dentalceramist, because I don't think there are many that are really good in Malaysia at the moment. So yeah, for students, for me now, I think I've already lost the passion to study for a long time already. So for students, yeah, you can look in that direction. Why not? You can still be a dentist, but at the same time, you could still take this up and probably go towards that direction. I don't think that's a bad idea. Yeah, and one of the possible challenges that we might find is not, I mean, because with so many clinics coming up and all of this, right? It's actually price war. I would say try not to go with the price war lah. I don't for my own clinics, I don't do that. I charge however I deem is suitable because I respect my own profession. So, but just treat your patients with sincerity and they will come back to you. Yeah, that's a bit old fashioned, but yeah.
Passion.
All right, thank you, Dr. Chan. And our next question to Dr. Ratna from Pravina here. If we are bringing in specialists to a private clinic, as I am a general dentist working in a private clinic, how much is usually the payment percentage for these specialists? For example, orthodontist or oral surgeon.
good controversial question. It depends. It depends. I would say I know some. I mean, the average commission that you pay is about 40%, but I do know specialists who expect up to 70 to 80% as well. So to avoid all the controversies, ask your specialist. What you think is reasonable as well. You don't want to pay so much that your clinic would probably lose out on that as well. So it really depends. That's a very technical question.
Okay, doctor, next question from Komugi. Hi doctors, how about pursuing specialization in future? Is it necessary to be in KKM in order to pursue, or we also can pursue while in a private practice? What is your advice about staying in KKM? How long would it be good to work for KKM? Dr. Gan?
This was because I had never applied for the specialization before. Can Dr. Chan help me to answer this? Sorry.
Yeah, no problem.
Yeah.
When you're in KKM, yes, you can apply for to further your studies. That's not a problem. You can apply something called HLP. But you have to wait for many years. So if you can wait, then you by all means go ahead. Because I have friends actually from PIDC still applying for that, and because they have very limited seats, limited quotas for people who are applying for HLP. Don't ask me what HLP stands for, I forgot. Yeah. So and also because with this contract now, I think when you guys graduate later, you guys will be on a contract basis, right? I'm not sure if you're on a contract basis, you can apply for that or not. Probably if you turn into a permanent, if they offer you a permanent position, then you can apply for that, no? And as when you go into private practice, of course you can further your studies if you have the money. If you have the money to fund yourself, by all means go ahead. I think it's a good thing to do to stand out of the crowd. Yeah. So you can also try to look for scholarships to apply for. There are various scholarships. Yeah. So you can try to search for that if you don't want to pay yourself to go and further study. So,
All right.
is that a question? Yeah, I think so.
Okay.
Thank you, Hoya.
No
Uh,
problem.
next question. Okay, next question. Doctors, for setting an X-ray machine, what CJ do we have to apply? Any criteria which we have to follow? Dr. Stephanie?
Okay. For setting an X-ray machine, okay, previously, I think around 3 to 4 years ago, before setting up the clinic, you can actually apply to install an X-ray machine in your clinic. But now the rules have changed. You have to have Borang C. Borang C is the clinic license after your inspection has been done and approved in Putrajaya CCAPs. Okay, so you have to get this Borang C first. After Borang C, you have to get your APC, right? Okay, so APC is the annual practice certificate which you have to renew every year, and you must have an APC for the clinic that you are working in. So once you get the Borang C and the APC, okay, only you can apply for the installation certificate. There are 2 certificates for X-ray. Number 1 is the installation license. The second one is the license penggunaan. You using the X-ray, you need another license as well. So the supplier will usually help you once they get the Borang C and APC. They will help you to apply for the the license installation license. Okay, so once the installation license has been approved by the atomic department and KKM, the supplier will install the X-ray in your clinic. Okay, so once installation has been done, they will send a technician to do a calibration, and the technician will do a calibration report. So this report will be sent for the next license application, which is the penggunaan. Okay, but before that, the particular person in charge have to go for an OPG course. If you're installing an OPG machine, X-ray machine, you have to go for an OPG course in UM. If you are installing a CBCT machine, X-ray machine, you have to go for a CPCT course. These 2 courses are a different course altogether. So once you attended the course in UM, they will issue an OPG certificate. Then the supplier will take all the necessary documents to apply for the certificate, the penggunaan. Then after that, they will send you another second license. Okay, only you can use the X-ray. So it's actually takes a bit of time. So you have to actually keep in touch with the supplier and the atomic department so that your application is in par with your X-ray installation as well.
All right. Well, some other questions kind of asking explanation regarding the early question that they already asked. But yes, from the Hilmi bin Osman again. No, sorry. From the anonymous attendee here. Good morning, doctors. Thank you for your insightful session. My questions for today would be: first, what are you all expecting to see from the young dentists who have just finished their housemanship and applying to work in a private practice? And second question is, are senior doctors willing to accept new dentists who are not adequately skilled but are willing to learn from you guys as the day goes on? Thank you. Yes, Dr. Chan.
Of course. Of course. We're not so mean. I mean, yeah, as long as you have the urge to learn and be humble, I think that's very important. Just be humble.
True.
And if you have the urge to learn, I don't think any dentist would reject such associate. Yeah, you have to have the right attitude, and that's all that matters. Simple. Done.
Done.
Searching for anything specific?
To me, one of the most important things that we look for in our associates is good communication skills. When it comes to dental skills, we all know it comes with practice, with experience and all that. But communication skills, your PR and your attitude, behavior is something that, it's inborn. That is something slightly hard to change. So that's something that we look at when you come for the interview, or, when you applied for a job. So even if you're just like fresh out of the government, that's still fine. That's fine. We all started from somewhere. We all came from that as well. But what's important is your attitude, how you want to, your eagerness to learn, being humble, willing to take criticism. Of course, you can also give your opinion. That's perfectly fine. But being able to take criticism is one of the important things as well.
Okay, I will go to the next question. From an anonymous attendee, what's the earning potential for starting your own practice as compared to working for another dentist? Dr. Gan?
Okay, earning potential. Okay, when you are starting a dental setup or a new dental clinic, you must have an end in mind, which means that you don't just open for the sake of, I would just want to own a dental clinic. You must set your own goals. What is your target for every month, especially for your sales? Okay, so for the first few months, you have to build up your patient flow, and you have to expect, okay, working in a private sector, that means you are working for someone, your salary will be static. That means, for example, more than 8K or 8K every month, okay? So that one is a very stable income. But when you're opening a dental setup, your income will be unstable depending on your sales, okay? So don't expect every month you will earn like more than 20K or 30K or 10K. You have to focus on your sales. So the earning potential is if your patient flow is stable, your management of your staff is good, and your flow is stable as well, your earning potential will be much more higher compared to work with other doctors. But you must always remind yourself that you have to keep in touch with your patient's flow and your follow-up your patients. Don't expect your patient to come back automatically. You have to put in effort on your management, as well as you have to follow up all of your patients so that your sales are stable. So once your sales are stable for the next 3 months, I'm sure that your earning potential will be better compared to working with other dentists. Because most of the dentists, I noticed, new dentists, they expect their patients will come automatically. You have to put in more effort on your marketing, as well as your personal follow-up with your own patients. It depends on your attitude and your market management as well.
All right. Thank you, Doctor.
You're welcome.
All right. I mean, like, we are getting a barrage of question here. And of course, you guys need to go because I mean, like, you guys are busy and having a clinic to attend to. But still, we're gonna try to take another 3 more questions. From Mr. Teo Kok Hao, as a private clinic, can we give promotion packages or sales to the customer? Is there any legal consideration here, Dr. Chan?
You can do it in your own clinic. In my opinion, actually, I think Ratna would be a better person to answer this. But I'll tell you what I think. You can actually display such whatever promotion or price at your clinic. Yeah. Out of that, in social media wise, that I don't do that because I don't want to kena kecam. So I don't do that at all. Yeah, I just tell them that I provide such and such and such service, and that's it lah. But I won't go like, oh, RM blah blah blah. I don't do that. So I think the rest right now can help with answering.
Yeah, so when it comes to promotions, again, you have a guideline for marketing. According to this guideline, social media, Facebook is still a very gray area. But again, when it comes to gray area, you are not allowed to publish any prices. You can't display any price. All these are not allowed. You can't use the word promotion even on your social media. So this is something you can't do on social media, but in your clinic premises, you're allowed to display anything you want, I would say. So you can have your own promotions. That could be part of your marketing strategies.
Next question, again from Eugene Cook. He said, shorter question this time. Can you briefly share your experiences as clinic owners throughout this COVID so far? Thank you. Anyone? Anyone can take this question.
Scary. My
Yeah.
God, is my nurse positive? Is this patient positive? Oh my God.
The day I heard about lockdown, I had an anxiety attack. I'm not even kidding. It was an anxiety attack. You know, you start thinking about, oh my God, how am I going to cover my costs and all that? How am I going to, cover all the overheads? That was the first thing. And then, you know, you hear that you are under essential services and you can run, right? So in our case, the first 2 days we did run. On the third day, I said, you know what, it's not worth it. This is back in March last year. We said, you know what, it's not worth it. It's not worth the risk. It's only 2 weeks. I mean, you know, we all thought it's going to be over in 2 weeks. So plus 2 weeks, you know. And then we reopened in April. Again, in April, what we did, we were only open for emergency treatment. So we really shortened our hours, we reduced our days. And what we also did was we worked in 2 teams. So team A doesn't meet team B. In case one team there's someone who's infected, team B can still work. You don't want to completely shut as well, right? So that's what we did initially. And then by May, we were working almost normal hours, but you have to be ready for reduced patient flow. But whatever it is, one good thing is we fall under essential services. So you still work, but you take extra precautions. But trust me when I say the anxiety, especially now that the cases are rising, you have to assume that every single patient is COVID positive, even your staff, if they could be COVID positive. So you have to take care of yourself. Kita jaga kita. And this is when it comes to taking care of yourself. But other than that, you would see a drop in business, but you still go on, you fall under essential services. So not too bad. You still get to take home some salary. Most people lost their jobs. So, so that's still all right.
Okay, thank you, Dr. Ratna. And our last question for the day is from an anonymous attendee here. Doctors, what are the courses do you all recommend or are essential to take up when we join private dental clinics? For example, what orthodontic courses you guys recommend? Implants or any endodontic specialist course?
I personally joined POS and I think that was quite useful. I only joined POS now. Implants I haven't, so that one you have to ask right now, or maybe Dr. Stephanie. But I haven't joined. I think POS is a good start. It's a bit more costly, but it's a comprehensive course. It really guides you properly as to how to diagnose an ortho case and how to actually do it. So you can think about that. Ortho is bread and butter. So if you really want to sell your own dental practice, then you need to at least have ortho in hand, in my humble opinion.
Okay. All right. Anything else, Dr. Ratna and Dr. Stephanie?
Many courses now. But back then you probably have to go looking for each courses. But now, indirectly promoting Dental City lah. They basically have everything in one book for you. You just go through the entire syllabus, speak to them. To me, that's a good way of starting. Like whenever I am in need of courses, I'll just go through the modules by them, and that's quite helpful. They have pretty much every single course at hand. Yeah. So.
Which one again, doctor? The name?
Dental City. Previously, they were called the Dental Academy. Yeah.
Okay. Okay. Thank you very much, doctors. The Q&A now will be closed. For the remaining questions, we will answer them separately, and we're gonna post it on our PVC Instagram story. Thank you everyone for sparing your lazy delicate Sunday morning with us, and thank you so much, doctors, for sparing your time with us amidst the busy schedule. I know you guys are gonna have to attend your clinic at 1 o'clock later on, but still.
Today is a Sunday.
Yeah, even though it's Sunday, I mean, like the dedication is something else.
Think about second. You have to think again if you want to open your own clinic.
Exactly. No off days. No off days. Okay. You have to work every day.
Just kidding.
Okay, and so for the audience also, we're gonna post some posts here. We're gonna allow you guys 1 minute to join the post while I'm gonna close the session for today. Okay, it is with my utmost gratitude that we can all benefit from this session in opening up our dental practice in the future. Until the practice is not open yet, everyone has like 50-50 chance of either succeeding or failing. But of course, success is a subjective matter, depends on how you see it. The main benefit is the experience we gather along the journey, where we discover ourselves more and help us grow into a better person. One might fall, but others will come and replace us, and this replacement will be better. And we cannot eat this without you guys, the audience. You all are the reason we are still here. Um, Continuing and striving for excellence and quality for our content. The survey and the feedbacks are very much appreciated. PVC will now take a break, and we hope to see you guys again in the future with a better, more intriguing content. Fret not, we will come back better and stronger. Thank you very much, doctors, and please, audience, feel free to join the polls. And thank you very much, everyone, and goodbye. Akmal and Archana signing off.
And
Au
the
revoir.
team of PVC signing off for 2021.
Au revoir et à bientôt.
That's it. No. As in,
Oh yeah.
2021, no more PVC. That's what I'm trying to ask.
No more
Oh.
events. It's
Oh.
we will start again.
Exam break, ma.
Yeah.
Oh yeah, forgot.
You both three of y'all are the closing curtain for this year.
Yeah. You guys are the finale of
Yeah,
PVC program. All right. Thank you very much, everyone.
Yeah, good luck in your exams. Thank
Good
you so
luck.
much.
Guys.
Doctor.
Thank you, doctors.
Bye.
Bye.
Bye.